Section B is about when you are still alive, but very seriously ill. This section contains orders about whether or not to be transferred to the hospital and decisions about medical treatments such as breathing tubes, surgery, and the intensive care unit.
There are 3 options in this section. Full treatment includes life support measures in an intensive care unit, including a breathing tube and breathing machine. Chemotherapy or radiation for cancer and dialysis or kidney cleansing machines also fall into this category. If you wish to have CPR attempted in Section A, you really must select full treatment in Section B because you will be placed on a breathing machine in the intensive care unit as part of the resuscitation process. The order in the middle is called limited additional interventions. People who check this box know that they do not want CPR or a breathing machine and would like to generally avoid the ICU. But for these people, it would still be okay to get other treatments to try and help their medical problems. For example, it would be okay for them to be transferred to the hospital, to get fluids through an IV, and to have cardiac monitoring. Oxygen may be provided through a tight-fitting mask called a BiPAP or CPAP machine. Symptoms such as pain and shortness of breath would also be treated.
An important difference between limited and full treatment is whether you are willing to be admitted to the ICU and possibly have a breathing tube inserted down your throat. If you do not want to be in the ICU or be put on a breathing machine for any length of time, you should select limited additional interventions. The third option is for comfort care. The goal of comfort care is to focus on the management of symptoms, such as pain or shortness of breath, but to generally avoid hospitals and IV treatments. People who choose this option will be transferred to the hospital only if symptoms cannot be managed at home or in the nursing facility. For example, if you fell and broke a hip, you would go to the hospital to get it fixed. The hospital may not be the best place for someone in the final stages of life. Sometimes there are complications from being in the hospital. Most of the time, medicine and care focused on symptom management can help ensure people are as comfortable as possible without returning to the hospital.